Yes, okay, you can run it. We'll just keep going. Can you hear me okay, Joshua?
Yeah.
Hey guys, Dr. David, M.O.S.A.I.C. Hello, I'm Dr. Dave Harper from M.O.S.A.I.C. And today's video is about carpal tunnel syndrome. Now, carpal tunnel syndrome is a name given to a condition where the wrist and the fingers have either become numb or painful, and the hand goes to sleep. There may be pins and needles, tingling, all of these different words, pain, all of these words describe what someone might have if they have carpal tunnel syndrome. Now the challenge is that, is the problem coming from the wrist or is it coming from another location up the arm towards the neck? Now if you're hearing this type of conversation for the first time, you may think, well, if it's carpal tunnel syndrome, why would I want to think of something at my elbow or my shoulder and my neck? And that's because, quite honestly, carpal tunnel syndrome is usually the end consequence. And here's the principle. The way we talk about it, and what we see in clinic when we try and help people with this, is that most of the time, greater than probably 75 or 80% of the time, a problem in the hand comes from the neck, shoulder, and elbow as it increases the amount of crush and accumulates that type of trauma to the nerve. So we talk about the brain being the root of the tree, the neck is the trunk of the tree, the arm is the branch of the tree, the forearm is the twig of the tree, and the hand is the fruit on the tree. Carpal tunnel syndrome usually happens maybe if there's been trauma to the hand, and then we would say, yes, it's a localized problem. But because the nerve begins at the trunk, the neck, and goes into the branch and the twig to get to here, there's possibilities of accumulated trauma coming from here, down to the wrist. And so solutions that are medically used are surgical releases. The carpal tunnel is actually here in the wrist. Most of the surgical releases are at the retinaculum, but the carpal tunnel is actually here in this location where the nerve actually comes through and comes into the hand. But what we often see is that there's an issue with the neck, and so we'll take x-rays, we'll see what type of shape of the neck it is, the neck has. We'll look at some muscle testing, we'll check some different types of compression points or constrictive points, like at the elbow or in the shoulder. There's something called thoracic outlet syndrome, where the pec minor actually can compress in through this area, the nerves, the arteries, and the vein, or the neurovascular bundle that comes out from the neck and out to the heart, down to the arm, and then it comes back up. So these are things that we want to look out for, and these are things that you need to be aware of when you have this type of condition.